everyone, welcome back to Face It with Dr. G. I'm Dr. G, and I wanted to just discuss some unscripted reasons why I use ultrasound. And the use of it in aesthetics is just flying around all over the place, and you guys know I'm very passionate about it. And I put a lot on my Instagram regarding ultrasound, but I wanted just to give you tips and tricks on how to integrate it into your practice, because what I've done previously is not exactly the same as what I do now. And that doesn't mean it's right or wrong for your practice, but it'll just give you an idea of how GFaceMD specifically has evolved. And if you guys have found my podcast and haven't found us on Instagram, you can head over to GFaceMD and follow the Instagram, or you can head to the website, gfacemd.com. And we're also doing a live conference in Cambridge in December called FACEit Live. And it's all about ultrasound and anatomy and how we can be better providers and incorporate all of these things. So when I first was introduced to ultrasound in aesthetics, it was through Dr. Stephen Weiner, who's a dear mentor of mine and colleague. At this point, we now refer patients back and forth and bounce ideas and complicated cases off of each other. But this didn't happen overnight. He had spent a lot of time during COVID and quarantine learning about ultrasound, understanding that this is the new wave of aesthetics. He created Sonosthetics, and now is an international legend of sorts in using aesthetics, in using ultrasound in aesthetics. And he has taught me a ton. And I've also read so many textbooks on ultrasound. So this is one of them, the Ultimate Guide to Point of Care Ultrasound Guided Procedures. And this one isn't specific to the face, but if you just go on Amazon and type in ultrasound and aesthetics, there's a bunch of books. The editor is usually Springer, and many of them are blue like this. So go check it out. Write in the comments if you have any questions. I can send over some exact titles for you. But I spent over a year reading about ultrasound, and I'm not a radiologist, and I've never really used ultrasound other in medical school, but I wanted to understand why. I wanted to see what was under the skin, and no, it's not perfect, but now the technology is just going to continue to evolve to help us and guide us with both injections and complication management. So when I incorporated ultrasound, I first bought the Clarius ultrasound, which is a handheld portable device. It is Bluetooth technology and can attach to your phone, connect to your phone or your iPad, which makes it super portable. It's pretty easy to use. Sometimes the connection can get a little bit wonky, but it's easy to use, and it's a great introductory ultrasound. I think that the price point is good for smaller practices. It's around $6,000 to $7,000, I think. And they have a ton of amazing tutorials and webinars that you can follow along with for education. So once I started using Clarius, I thought, okay, this is ridiculously amazing. I want more. I said, I don't want to have to deal with the connection issue. The battery life is a little bit lower than I want because I use ultrasound all the time. So I wanted to have another option. So then I found the Mindray technology, which I absolutely love. I have the TE5 system. It is phenomenal. It's big. The wheels on it are kind of bulky, but it's the battery life lasts a long time. The screen is big, and the technology is just better. You have two options of high frequency probes, and it is fantastic. It has a lot of other capabilities. You can actually talk to it. You can record videos. You can use pulse wave Doppler. You can have the color Doppler, and it's great. I love it. I use it all the time. And now I continue to research others, and Philips has some incredible ultrasounds that are really high tech, maybe completely not completely necessary with all of the utility in some of theirs, but they have some really, really amazing ones. And then GE also has some amazing ultrasound. So I just continue to research and learn about them, and I ultrasounded pretty much every patient. And I think a lot of you have questions, okay, how am I gonna learn this? I can't read it from a book. How do I do this every day? It's time. Time is money. If you're a business owner, I get it. But if you're really invested in this and invested in increasing the safety and education of you and your providers, it will pay off in spades, not only in your patient results, but hopefully financially. We want you to be around. We want you to make money, right? That's the point. But it's worth it. And not only will it help with patient satisfaction and patient management, but it will help you reinforce your knowledge of anatomy. And when you look at that cadaver, when you have dissections, which we don't do every day, you'll understand it more because you've been looking at the ultrasound. So I used it on every single patient. I did not charge them for ultrasound. I just integrated into my practice. Now, what is evolving at GFACE-MD is our providers are all learning ultrasound. We will do vascular mapping. I know some people don't necessarily like that term anymore. We look for vasculature in areas that are more high-risk areas before injections. And we also like analyzing vessels in more complicated filler patients and how those vessels have changed. Maybe they have hypervascularity, and looking for themes in patients, because again, we're always learning. So essentially, I don't ultrasound every single patient now, but what I do is in certain areas like the temple and the piriform, I like to analyze the preauricular space and measure the thickness of the skin, the subcutaneous tissue that's above the parotid gland, and make sure that you know that depth, not only so that you don't inject products like Sculptra into the parotid gland, which can result in problems, but you can also manage and measure the growth of that subcutaneous tissue and the collagen, because that's why we're doing it, right? So thinking about use that way. And now I get patients that come in from all over the country and they want ultrasound management. And this is a whole different ballgame. So I have now ultrasound guided dissolving, which is a certain service that there's a fee associated with that. And I think a lot of you want to hear the pay structure because we all have questions about this. I'm not perfect, but this is how I do this now. So we have ultrasound guided dissolving, which is dissolving that's including an ultrasound evaluation. But if I have patients that are coming to me just for this ultrasound evaluation to see where their filler is, you know, can we quantify how much it is? What layer is it in? How easy is it to dissolve this filler? Getting a whole picture together, understanding the vasculature of that patient. Then I charge a fee for a thorough ultrasound evaluation. And if that patient decides to then go on to dissolve it, that's another treatment. But I have integrated that procedure and treatment protocol into my practice. Is it perfect? I'm not sure, but I think everybody is trying to figure out ultrasound in their practices, how to use it, and how to provide this service in the right way to your patients. So once we ultrasound patients, we always keep those images and clips on file. So we'll keep them in a drive that we store them in, and we also put them in the patient's chart. So it's pretty easy to get the images from the ultrasound to the patient's chart. So it's important. You can store them. I think with a Mindray, they store on there for about a week or so, but you want to get them off of the ultrasound and keep them in a safe place, not only for teaching purposes, you know, in the future, but for the patient's chart. So that's what we do. And, you know, I have to say, overall patient satisfaction, overall management, overall safety has just shot through the roof here at GFACE-MD, not only with you know, the providers and how quickly they're learning ultrasound, which is facilitating their knowledge of anatomy, but just overall patient care has been so amplified that I can't imagine not using ultrasound. I will say I've had cases of potential vascular occlusions, and maybe they weren't, maybe they were, but I feel so equipped with every ability to evaluate any potential abnormality or adverse reaction, and then to visualize it and manage it. So it is something that I guarantee everyone's gonna have in the future. And if you don't have one, I offer medical director services in the Massachusetts area, in the state of Massachusetts right now. And all of my network has access to these ultrasound machines, which again is something I'm so happy about, and they are too. So there you go. I hope that was helpful. Just a little bit of the raw and the real, just how I do things here, how it's evolved, and I guarantee you it's going to continue to evolve. That's what we're here for, and it's super exciting. So let me know your questions about ultrasound, comment, send me a message on Instagram, share this, like, subscribe, and I will see you guys next week.